So this patient's coming in for evaluation of a ulcerated area in the back of his heel. He had caught this maybe a month or so ago on a screen, and it's just not healing properly. And then if you pan up this way, you can see there's another area here where, again, he had just nicked it and it's just not properly healing. The big message is when you see an area like this that's not healing, especially in conjunction with this, you should automatically start to think that there's some type of vascular problem here. And sure enough, on history, he also sees a vascular surgeon once a year. No one sees a vascular surgeon once a year for nothing. So he obviously has an element of peripheral vascular disease, and it turns out he's also diabetic, which is a vasculitic sort of syndrome as well. Does that hurt when I do that?
No, a little bit.
Just a little bit. So he has no freezing in place right now. We're going to try and just debride this tissue, so take this dead tissue off. And the reason why we do that is in order for tissues to heal, healthy tissue has to migrate across this surface. If you have callus buildup here, or if this eschar is too thick, it won't be able to do that. And we have to take that down so that can actually heal properly. So we can do a manual debridement. Debridement just refers to the removal of a dead tissue. But then you can also use specific creams that'll actually help us with that as well. So just going to see if we can take this down. No pain when I do that?
A little bit.
Like on a scale of 1 to 10. Is that a 2? Is that a 4? Is that a 6?
Almost nothing, but a little bit.
Okay.
I feel it a little bit, but...
You're aware of pressure?
Yeah.
So again, the reason why typically you can take down thickened callus tissue, and it's not usually uncomfortable. So I'm not doing that to be cruel, but especially with diabetics, usually this is tolerable, and the freezing is much worse than just taking this down. So I'm working with a new Dr. John today.
Hello.
This is a baby Dr. John. He's just starting. So how much debridement would you think I would do? Like, what's too much? If it starts to bleed, have I gone too far?
Huh?
No, I'm just asking the resident a question.
Oh, okay.
But you're welcome to answer too if you'd like.
If it's bleeding a lot.
Yeah, I would tell you if it's bleeding a lot, we've probably gone too far with things. But don't be afraid. Like if it's just, speckling a little bit, that's okay. Healthy wound beds that are moist are a good thing for us. So generally, if you're not used to debriding, you're probably wanting to take more than less, because the more that you can get healthy tissue coming across, the better off
Now
you'll
I
be.
have pain a little bit.
That hurts a little bit. So again, on a scale of 1 to 10, what is that? Is that
9.
a 9? Okay, so I'll leave that alone. So and what that would push me towards too is there's different types of ulcerations.
Pain, yeah.
That pain. So again, how high is that? Is that
10. 5.
Okay, I was gonna say you're in good spirits for a 10.
I have no money.
But to his point, so when I'm pulling on the tissues, he's feeling it there.
And
See
now
that?
he's 9.
Yeah, that's what I'm saying to you. So I just want to take down the dead tissue.
I have to laugh. Okay.
So I don't want to cause him unnecessary discomfort. So once I get this tissue off.
In my country over there, my uncle, everybody is doctor. Every single.
Yeah,
I have 10 doctors in family.
I imagine.
Yeah. And oh, that's my phone. My wife, my dog,
Here, Dr. John, why don't you bring in his phone?
No, don't worry. Oh, thank you, sir. I think that's my wife.
So as much as possible, I want to smooth out the skin.
My daughter.
How many kids do you have?
I have only my daughter and my son, both married. I have 2 granddaughters, one 13 months, 17 months.
Oh, that's nice.
Oh yeah, that's
Just a baby.
perfect.
Yeah, I'm not going to be playing with that much.
Yeah.
I'm just trying to take a little bit
Can I
off.
talk just a little bit with daughter?
Yeah, that's fine.
Ehi, è un mirade scrive io cosa che non sapete.
See, that border is what I want to be taking it off.
Thank you for.
That's okay. See, that's what we want to get off. And I want to, as long as I'm not moving this, it's when I'm shifting it that he's having discomfort. So we should be able to just smooth that out. And so you're always left with a decision here about if it's too uncomfortable. That should push you towards 2 angles. One is looking at the overall diagnosis and seeing if we're correct. So my point being is there's decubitus ulcers, there's arterial ulcers, there's vascular, there's venous ulcers. Which ones are more painful, venous ulcers or arterial ulcers?
I would say arterial because of the pressure of the blood flow.
Yeah, arterial ulcer is much more uncomfortable. They typically don't look like much, but patients are really, really uncomfortable. This looks more like a venous ulcer, but how he's describing it makes you wonder, could there be an arterial component to that because he's so uncomfortable? And that's something we can determine once we get our imaging studies back and see what that looks like. But at this stage, I can still clean this off and allow the margins to come together.
Mm-hmm.
If this is too uncomfortable, I'll just, yeah, that's what I'm saying. I'll leave that part alone and just see if I can get this off.
What makes this look more like a venous ulcer?
One, the bed is more moist. It's a larger space, so usually arterial ulcers are typically smaller when they're just originating.
Mm.
So do you know of any autolytic debriders, any creams you could use? So once this is done, what we're doing is manual debridement, so we're actually using the scalpel to take off dead skin.
Mm-hmm.
But there's actually creams that can do that as well.
Mm.
Do you know of any?
Not yet.
Which is fair. So, and he's just starting. So this Dr. John's like a week with patients. So there's something called iodosorb, which is a very good product. There's Metahoney, Metahoney aspartate. There's different products like that, and they're designed to recognize dead tissue and slough it off. And that's called a chemical debridement or autolytic debrider.
Mm.
And when you combine that with other products to see if it'll help this heal. So beyond that, you can tell how this is, it's a little bit moist at the edges.
Mm-hmm.
So sometimes these weep a little bit. Is that too uncomfortable?
Yeah, that's okay. Just cream. Who give me, Dr. Yusuf?
Yeah, so we'll check and see. So he saw his orthopedic surgeon.
Pain.
Yeah, lots of pain?
Mm.
All right, so
Yeah.
I may not be able to touch that much.
Yeah. But that's okay. I can take.
Is that dead skin on the top too?
Yeah, if I can. So if, like I said, if he's, I'm not going to do him this much because if it's too uncomfortable for him, I'm not. The more we could remove of this, the better we'll do.
Mm-hmm.
You can cut that.
No, I'm just going to just play a little bit. Yeah. But so the reason why I'm reticent, so injecting anesthetic is certainly an option here, but anesthetic into deep tissues where there's lots of muscle is painful, quite painful. So this is an area that if I can't just debride this manually, I'll just use the cream, the autolytic debriders, that'll actually soften this up, and then we see it in follow-up, we can actually slough this off. Because this eschar that's here, this has to come off. So if I didn't feel we had, or the product wasn't taking it off, then I'd be committed to sort of say specifically that I'm going to freeze this up and I'm going to take it off. But I think we'll be able to get there using the chemicals.
Mm-hmm.
Is that okay there?
Yeah, a little bit pain, but it's okay. I can take.